I'm Carl Leitner. I work for IntraHealth. We're talking about the Care Services Discovery Profile and the Open Info Man, which helps to meet several different use cases in terms of patient scheduling, provider, patient referral information. So we have several use cases. For example, a patient comes into an emergency room. The emergency room staff wants to notify their primary care physician that they were admitted, but that's not within the same hospital network. So the primary care, the emergency room staff needs to look up the name of the provider, get their contact details. When the patient is discharged from the hospital, the ER staff wants to have a follow-up visit scheduled with their primary care physician. So that they want to see when the primary care physician is available and actually send an invitation to that person. Coming from the other side, the primary care physician might want to do a specialist referral in the location of where that patient lives, so they want to search for specific services based on geographic information. So we have an Open Info Man is the engine that runs a lot of this. It's based on the Care Services Discovery Standard from IHE, and what we can do is we can just step through some of these use cases. In our search bar, type in the name of our provider, we get a search, and our search results, we already get the contact information, the email address, the business phone, the mailing address for that provider. And then we can get into some of the scheduling information. We look at the scheduling information, we see, first of all, we can open up a calendar, and we can see some of the times where the provider is marked as being free or busy. Coming back, we can also look at the operating hours for that provider. So here we see at the facility that this provider is working, we can have operating hours defined. We can also have, for the different services that provider provides, specific hours that they offer those services. And that might be something defined by the organization that they're working for or something specific to that provider. So we've got several different ways to capture that availability. Once we know the availability and for the specific service, we can send an invite. So here we can say, okay, we want to do a follow-up visit because the patient came to the ER. We select a date and time for that follow-up visit, and we say, okay, 2 hours worth of follow-up visit. We submit this. It gets relayed and sent to the provider. If we open up the provider's email account, we'll just see, oh, we have a scheduling request. The scheduler for the PCP can then accept that schedule request, and then that's now updated back in the calendaring information. So we now can see that, okay, when can somebody else schedule? There's lots of key use cases that are met here. Just show quickly how it sort of functions within the workflow is that you might have several different sources of provider information, whether it might be a hospital or a state exchange, and all that information can be collected and merged into a single document that's exposed and queryable from the different points of service. So we're seeing implementations of this in Nigeria, Rwanda, Zimbabwe. I think there's also some considerable interest in France in terms of emergency response and ambulances and exposing them through this data model. It really connects the provider, the organization that the provider is working for, where they're working, and the services they offer, and gives some ability to do some scheduling based on that.